Hello and welcome to the next in our alphabet series of common foot conditions and complaints. And what is on the coldest week of the year so far, apparently, we are very appropriately onto C for chilblains. Now, what are chilblains? They are those small, itchy, burny, painful swellings that you usually find on the toes, but can be on the soles of the foot as well. They turn the area a red or a dark blue colour. And they are a reaction to cold temperatures, so they are much more common during the winter months. And it is where the blood vessels constrict in the cold weather and then can get rapid expansion when exposed to warm conditions very quickly. Now, you are more at risk of getting chilblains if you have poor circulation or peripheral arterial disease, or if you have a family history of chilblains as well. Regular exposure to cold, damp, drafty conditions will increase your risk of them. And if you have any conditions such as lupus or Raynaud's, which is a vasoconstrictive disorder, again, you are quite prone to chilblains. If you're a smoker, unfortunately, that does constrict the blood vessels as well, so that will make you a little bit more prone to getting them. And if you have poor tissue viability for any other reasons, any other medical conditions, you do need to be careful as well. Now, with chilblains, prevention really is the best cure. So if you can keep your feet and ankles nice and warm, that will reduce your risk of them. Wear nice warm trousers and warm socks. Make sure your shoes have a nice thick sole to them and they're not kept in a drafty cold place. Try and warm them by a radiator first. Try and make sure you keep your house and your car nice and warm as well, so you're not getting those varied temperatures in the extreme. Keeping active will also help because it keeps the blood flowing round the foot and it stops it pooling in the extremities. Also, if you are a smoker, it is advisable that you do stop smoking, unfortunately, and check your feet regularly. If there are any sore areas, get them checked out right away. Now, if you do have a chilblain and you're looking for treatment for it, you can get some lotions and creams from the chemist, some chilblain creams, which are a warming cream, and they can help as well. But if you're getting recurrent chilblains, it may be worth speaking to your GP. There are some medications that you can take that help keep those blood vessels open better. The complications from chilblains are that they can ulcerate, they can start to break down and get infected, and they can also cause scarring and tissue discoloration if they are there for long periods of time or reoccurring. So it really is important to check your feet on a regular basis and make sure that you're getting those looked at. Try not to scratch or rub the chilblains, and try not to rapidly expose your cold extremities to hot things. Try and warm them up as gently as possible, and hopefully you won't get too many problems.